Super exciting news when it comes to Lyme testing and chronic Epstein-Barr cytomegalovirus testing. In the past, we've always used antibodies, and antibodies are great when we're looking at IgM, and IgM is an initial responder, IgG are past responders. Now, we have been looking at early antigen antibody IgG for Epstein-Barr and for cytomegalovirus to look for chronic replicating viruses. And when it comes to Lyme, we use much bigger Lyme testing. The ELISA and Western blot tests are terrible. You have to do it within 3 days of having a tick on you. Otherwise, it's really an invalid test. This new testing we have is extraordinary. We're looking at actual cytotoxic T cell activity. We're looking at interferon gamma, interleukin-2. Interferon gamma can help coordinate immune response and coordinate CD8 or cytotoxic T cell response towards Lyme disease. And we'll test for not just Borrelia burgdorferi, but also Babesia, Bartonella, Ehrlichia. We'll look at Rickettsia, which is Rocky Mountain spotted fever. And then we can also look at how it affects Epstein-Barr and cytomegalovirus. We also will get interleukin-2 on all of those, which really works on the growth, activation, and survival of the CD8 cells and the cytotoxic T cell activity. So when we look at those, we're looking at an acute response. And better than anything on these tests, we always test and retest after treatment to make sure we're getting the results that you should be expecting. But before, when we were looking at the antibodies can survive a long period of time. So as we're treating, you can watch the antibodies come down. We've always said within a year and a half to 2 years, we expect full remission on all Lyme patients and all Lyme variants. And with Epstein-Barr, probably within about a year. Cytomegalovirus, probably within a year. But now we might find out it's much faster because now we're actually get to see the acute response versus just hoping maybe that antibody is already gone, but it has a lifespan of 8 months to 2 years. We get to actually see the cytotoxic T cell activity. This new testing is awesome. We can send it anywhere. The future is bright when it comes to Lyme, Epstein-Barr, and cytomegalovirus testing. The more you know.